Welcome back. So now let's talk about the pharynx. The pharynx is also known as your throat, and it is just a passageway for either air to move or for food and drink to move, okay? It is composed of stratified squamous epithelium. The nasopharynx is composed of pseudostratified columnar epithelium. Why can't I? Oh, boom, sorry. Pseudostratified columnar epithelium. And then the naso and laryngopharynx are composed of stratified squamous epithelium. And so in this case, we're going to move directly into the laryngopharynx and down into the larynx, okay? So we've just talked about the nasal cavity and the pharynx, and those are part of what we call the upper respiratory tract. So upper respiratory infections like colds affect the nasal cavity and the pharynx. Now we're going to look at the lower respiratory tract, which starts with the larynx. The larynx then is our voice box. It's often called the voice box. It is a small cartilaginous structure that leads from the pharynx to the esophagus, but within the larynx there are special cords that allow or that vibrate when air moves through that allow us to speak. So you can see these cords here. These are composed of a connective tissue, and as air moves into the trachea, they cause these cords to vibrate. And so depending on the vibration, so how large the vibration or how small the vibration will determine I'm having trouble with my vocal cords right now, aren't I? Will determine how loud the sound is. So small amounts of air going through can allow you to whisper when you're trying to talk really, really small. Which I don't know if you heard that, but I was actually whispering. I guess that wouldn't be as good. If I'm in class, I can do that. It's pretty effective. But and then, of course, if you're getting lots of air moving through, you can talk much louder. Vocal cords also help with coughing and sneezing reflexes. But there is some issues with vocal cords, or not just with vocal cords, but with the larynx itself. I don't know if I mentioned the top of the larynx. I'm going to bring you back to this one just so you can see. The top of the larynx here is the epiglottis. The epiglottis is the structure that closes over the windpipe or trachea so that we don't get air, water, or I should say food or drink moving in. And that leads us to this problem of laryngitis. Laryngitis is inflammation of the larynx. And typically when you have laryngitis, often caused by either some infection or by overusing your vocal cords, you end up with a sore throat, a hoarse voice. If it's caused by bacterial infection or viral infections, it can also lead to fever. But in serious cases, laryngitis can lead to what we call epiglottitis. And that is what we're seeing here. So this is a nice normal epiglottis. Here we have an inflamed epiglottis. And the problem is in young children, again, it's always the young children that seem to get affected, doesn't it? In young children, if this epiglottis gets inflamed, it can actually close off your trachea, and that would lead to death. So it's really important if you are young and you have laryngitis that you get checked out. So from here we're going to move into the trachea, which is also known as our windpipe. The trachea extends from the larynx to the bronchi. So here we go all the way through this trachea, and at this area we call the carina. This is where our primary bronchi branch off. They look pretty much just like the trachea. So it looks like the trachea, and then it just branches into two, or one road, two roads, okay? Trachea is anterior, the esophagus, and that's important. It's lined with pseudostratified columnar epithelium. It has a mucous membrane, so air moves through the trachea, and can any potential pathogens can get trapped in the mucus, okay? And then the cilia are always beating away from the lungs towards the throat. So the trachea itself is held open by these cartilage, hyaline cartilage. They're C-shaped rings, and that's important to note. The rings keep the tracheal tube open, so you don't want that windpipe to close up. If it closes up, then no air will move through. But it needs to be open on the back side. And so this is a figure I got from another, from Get Body Smart. So you could see, here's that C-shaped ring. And then on the posterior aspect, there's no cartilage. And that's important because you need to, so right here, you see how the trachea, and then behind it, posterior to it, is your esophagus. Your esophagus, when food enters, it's a muscular tube, so when food enters, it has to be able to expand, and so it oftentimes will expand right into the tracheal region. So food goes in and it expands here, and then it can go down. And so that's why you can't breathe when you are swallowing, and that's also why choking is such a bad thing. So if food is going down in the esophagus and it gets stuck, it's clogging up or closing up that trachea, and that's dangerous. And I mentioned the carina is the bifurcation of where the bronchi come out, okay? So tracheotomy is a tool that is used when there is a blockage in the trachea or in the windpipe, and so you can't breathe. They will oftentimes use a tracheotomy to allow you to start breathing again. This is typically done by a doctor, and it is a life-saving procedure. So what happens is they're going to cut through the skin, the dense connective tissue. They're going to then cut through the muscle. Once they get into, and they can see the trachea, they're going to cut between the C-shaped cartilage, and then they're going to stick a tube in that allows you to breathe. And, hold on, darn it, I know I did that. Yeah, there's a video here that you can watch that shows how a tracheotomy is done, okay? So from there, we move into our bronchi. So here is that carina, and this is where the trachea bifurcates. So it's going to move into the right and left lungs. So air moves in to these primary bronchi, and the primary bronchi branch. As soon as they enter the lungs, they branch into lobar bronchi. So our right lung has 3 lobes and our left lung has 2 lobes. And so we're going to have 3 lobar bronchi in the right lung and 2 in the left lung. And then from there, the lobar bronchi branch into multiple segmental bronchi to each segment of each lobe. These are going to move to those segments, and then we have bronchioles branching off of the segmental bronchi that will then eventually lead to what we call terminal bronchioles, and those lead to our alveoli. And the alveoli are the sacs where gas exchange occurs. So air is moving a long distance just to get into our blood. The bronchi are supported by cartilage rings also to make sure that they stay open. But as we move into the lungs, the further we move in from the primary bronchi to the lobar bronchi to the segmental bronchi, we lose support. And so by the time we hit the bronchioles, there is no cartilage anymore. And so these are super small airways, but the small airways are able to be held open by the smooth muscle that surrounds them. But that also allows us to allow for more or less air to move into our lungs. So bronchoconstriction would be those smooth muscles constricting or contracting, causing less air to flow in. Bronchodilation allows for more air to flow in. And that can actually lead to problems when you have more air moving in is not going to be a problem. But because there's nothing holding those airways open, bronchitis is inflammation of the bronchial tubes or the bronchioles, and that causes the airways to constrict. So you can see here that inflammation. So acute bronchitis occurs typically when there's an infection. Causes pain when you breathe. Coughing, sneezing is accompanied with it. Well, both. So whether it's chronic or acute, coughing is always accompanied. And then fever is usually associated with acute bronchitis. Chronic bronchitis is typically associated with long-term irritant exposure. So you can have chronic bronchitis if you are a heavy smoker. Once you stop smoking, you're still going to be coughing. It's called that smoker's cough. A lot of people in the morning when they smoke, in the morning they wake up and they have a really bad cough that they have to like get through. They have that morning cough and then they can start living their day normally. And if it's for a very long period, that causes permanent changes, so damage to those bronchi, and that is dangerous. And that's what leads to chronic coughing and pain. So then we move into those smallest bronchioles, or I should say, then we move into the respiratory zone. The respiratory zone is associated with our terminal bronchioles, our respiratory bronchioles, and the alveolar sacs, okay? And this is where gas exchange occurs. And so here we can see terminal bronchioles, and then down here we have those respiratory bronchioles, and then we have those alveolar sacs. Alveolar sacs are tiny little simple squamous epithelial tissue that allow for gas exchange to occur. And then there's blood vessels associated with them. So when gas leaves the lungs, it goes right into our blood, and when that happens, carbon dioxide from the blood leaves and goes into our lungs, which is why we exhale carbon dioxide. Asthma is associated with bronchoconstriction due to sensitivities in different allergens. So it could be, and there's a lot of triggers for asthma. You could be allergic to pollen or to certain wheats or grasses. You could be allergic to dander that could set your asthma off. No matter what happens, when you have an asthma attack, these very small bronchioles fill up with lots of mucus and they start to close up. This is actually a protective mechanism to try and keep damaging agents out of our lungs, but our immune system basically is oversensitive. And so it causes problems with air moving in, and it can actually lead to the inability to breathe. So our oxygen level lowers a lot, and that's when you end up in the hospital, getting breathing treatments, you know, everything like that. So typical treatments. So if you have an asthma attack, people with asthma have bronchodilators that they just keep with them at all times. And that is the most common, or the one that I have, is albuterol. And so we just keep that with us just so that if we have an attack, we have that on hand. And that immediately opens up our airways. So that is a short-term treatment. You need long-term treatment, though, if you want to live a normal, happy life. And so most of the time, people with asthma will also get some type of a treatment that is long-term. So inhaled steroids help to maintain the integrity of our airways, so it holds them open all the time. It's not, you don't use an inhaled steroid to open up your airways. It just helps to keep your airways open all the time. And so that actually is more of a long-term treatment. And so an example of that is Advair. Advair is used, you use it twice a day, every day, and that keeps you from having to use the albuterol. So I also use Advair every day, twice a day. So there are always, you know, anytime you have a treatment, there's always side effects, potential side effects. And with Advair, one of the side effects, because it's an inhaled steroid, it can actually lead to thrush. So thrush is a yeast infection in the mouth. So I've never had to worry about that, but so far I've never had to have worry about that. But I follow certain rules. So once you use your Advair, then you're supposed to rinse your mouth out very well. And so I brush my teeth right after I use my Advair. I use it in the morning, I use it at night. I brush my teeth in the morning, I brush my teeth at night. So it works out. That cleans my mouth and keeps me from having any problems. And then I have my my bronchodilator that I don't have to use very often. So this is a figure from your textbook that shows normal and asthmatic bronchial tissue. So here's what normal tissue looks like. You see that thin layer of mucus. Here you see much thicker layer of mucus, and you see all of these eosinophils and other mast cells that are increasing in numbers, that are going to start secreting chemicals that cause all kinds of problems in this individual here. And that's the difference between a normal and an asthmatic lung tissue. Or does that make, I hope that makes sense to everybody. And that's why people with asthma have so many problems with breathing a lot. Oh, there we go. All right, I'm going to stop here because it's been 18 minutes, and we'll get into the actual bronchioles and alveoli in our next video. Bye.